So if we've got missing teeth, quite often we've got three solutions. We can have a removable denture, we can have a bridge in certain situations, or we could have a dental implant. So why would we choose a dental implant, and what are the scenarios where a dental implant might not be the kind of the best solution? Let's explore this in this short video. First, let's look at dental implants, because now we do a lot of dental implants and we do far fewer of the other two options. So beware, I might be a little bit biased in this video. So the reason that dental implants are generally regarded as a really good solution for tooth replacement is that they are their own standalone thing. Okay, so let's take a situation where we've got a whole bunch of teeth, one tooth is broken and it can't be repaired, then it's quite possible that you could have a dental implant there. You take the bad tooth out, you have a dental implant placed, let that heal, and over time you can have a tooth placed over the top. Note, there's no adjustment to the teeth either side, and this is why dental implants are traditionally thought of as being better than a bridge, because with the bridge option, we've got the same scenario with this broken tooth. With the bridge, you would have to do some adjustment to the teeth either side. Now, there's different types of bridges, and some require very minimal adjustment, and some will require much more adjustment, as if you were going to have a crown on those teeth. Adjusting healthy teeth is something that we try not to do, because in some cases it can reduce the lifespan of that tooth. Saying that, if the tooth has already had quite a lot of work done to it, then you might not be adjusting so much tooth in that situation. But then we've got the question of how strong is this tooth? So a tooth which has had loads of stuff done to it may not be as strong, well, it's not going to be as strong as a natural tooth. So we're kind of like weighing out all our different options and understanding what the best thing is. And this is why it's so important to see an experienced clinician and have a discussion about your individual situation. The bridges where we hardly adjust the tooth either side, they can be great, they're really quick, they're easy, they're kind of cost effective, but the downside is that because they're kind of using a glue adhesive, that adhesive can just suddenly break, and it means that you have to have the thing glued back in, which may not be that big a problem, but you have to take time off work, or it might happen on a weekend just before a holiday, something like that. It's always going to happen at the most inconvenient time. But talking about the cost of these things, it's going to vary from clinic to clinic. Dental implants are typically the most expensive option. But let's say we've got a situation where we've got a missing tooth at the front and we've got the option of a bridge or an implant here. If we chose an implant, we'd end up spending, say, argument's sake, around £3,000 for the implant, and a veneer or a bridge might be £3,000 per tooth. Now, in this situation, you might think, oh, well, I've got to replace this front tooth, but the other teeth don't look so great. So it'd be really nice to maybe improve the appearance of the front four teeth. So you could have a bridge, which will change the appearance of the other teeth, and maybe a veneer. Okay, this is we kind of call this as a mini smile makeover, where you just do the front four teeth. It'll be quicker than having an implant, and it's going to cost a little bit more. Typically a bridge, it might cost £1,000 a tooth plus a veneer, but the actual benefit, the overall appearance, you'll be able to get more for your money if you do four teeth rather than a single tooth implant. So in some situations, a bridge is just not recommended. Let's say we've got missing teeth at the back. For a bridge, you need to have two solid anchors to support that bridge. So if you've got no teeth all the way back and you want to replace those, then we're looking at either a removable denture or something on implants. Now, a denture can look absolutely beautiful. The reason people tend to prefer an implant solution is because it's fixed in position. That's the major advantage, especially when you're looking at a whole bunch of teeth which are missing. So a denture is not fixed in position. Even if you connect it to implants, it's kind of clicked in. It's a removable solution. That has its own advantages in that it's much quicker, it's cheaper to make, and it can replace those teeth, allowing you to chew and eat more comfortably. It will move around a little bit, but for some people, that's absolutely fine. It's not a big deal at all. Now, in order to have implants, we need to take CT scans. We need to assess your individual situation, look at the amount of bone available. And it may be that you need additional treatments like bone grafting and maybe sinus lifting, which we'll cover in other videos. But it means that the implant treatment isn't going to be as simple and straightforward. This is going to increase the time, it's going to increase the cost of dental implant treatment. So this is going to have a big bearing into whether a bridge is a better solution, or a denture, or implants. And as always, I think it's better to speak with an experienced clinician, somebody who does the implants and maybe that does the other options as well. And you can understand your situation, go through your CT scan and find out what the best solution is for you. Because at the end of the day, every treatment will involve certain risks, advantages, and disadvantages. So what are the risks with dental implant treatment? Well, we've got another video, another short fire video in this series all about the risks involved with dental implant treatment. So if you want to watch that, there'll be a link below, or it's just the next video in this series.